Senator Corbett, thank you very much. You have SB 895.
Yes. And then Senate Bill 895 is a companion measure. It also to address concerns highlighted not only at Valley Springs Manor, but also other facilities around the state. Also, when this situation occurred, I did a little bit of research and found out that a very important tool was not available, and that was to have ongoing inspections of facilities to give the state an opportunity to determine whether there were problems occurring at these assisted living facilities. And once upon a time in this state, we did have annual inspections of such facilities, but over the years, those numbers of inspections have decreased. It was changed to 2 years by state law and then eventually 5 years by state law. And it turned out that we might not have even been meeting our every 5-year standard of inspection. And again, this was just to allow the state to go in and make sure that the laws of the state were being complied with regard to licensing and the care of individuals at assisted living facilities. So this bill would allow for annual inspections, would also create a 10-day compliance period for issued deficiencies. So in other words, if there were some problems, a facility would have the opportunity to have some time to comply. And then also would allow for a 30-day extension if the Department of Social Services determined that that extension would not in any way jeopardize the health or the safety or the security of the residents in the facility. And the bill will also provide that any results of such inspections would be made available to the public via the department's website or their district offices. And that's for the purpose to, again, allow family members to have some information so they can make good decisions with regard to where they place their loved ones to be cared for. So we've been working with all the stakeholders and the committee staff. We've taken amendments to address concerns that were raised, and we're glad to continue to work with the stakeholders if there are other outstanding issues. But again, the whole point is to help us ensure that the state law to protect frail elderly people is being complied with. And the way that to do that is by inspecting. And that also gives you an opportunity to work with an owner and a manager and help them put together a plan to make sure that the right things are being done. So anyway, also here to testify today on behalf of Senate Bill 895 is Tony Chicotel, staff attorney at California Advocates for Nursing Home Reform, who are the sponsors of the legislation, and also Eric Carlson, who's directing attorney at the National Senior Citizens Law Center.
Okay, thank you. In support of the bill.
Yeah, good afternoon. I'm Anthony Chicotel, staff attorney for California Advocates for Nursing Home Reform. Prescott's a senior staff attorney. I guess that makes me a junior staff attorney, but I'll try to up my game. I'll be brief. There's an RCFE care crisis. It's been well publicized. It's handled very well in the bill analysis that the staff put together, the chronology of events in 2013, detailing really some horrible cases of injury and death in RCFEs. And there's really two main causes. One is an increased acuity of the residents. When the RCFE laws went into effect in 1985, it was a different kind of population. You look at nursing homes now. Nursing homes are all about short-term care. We think of them as long-term care facilities, but the business model is evolving to focus on rehabilitation, short-term stays, less than 100 days on Medicare. All of your long-term residents that in the past were in nursing homes are now in assisted living, RCFEs. So the needs have really increased. And ironically, the state presence in the facilities has evaporated during that time. Initially, licensing would go out unannounced to do inspections twice a year, and it's now down to once every 5 years. So a reduction in presence by a factor of 10. So we've kind of reaped what we've sown in that regard, and we've got a significant care crisis. And this bill brings us back up to a once a year annual inspection, a comprehensive inspection, looking at the facility's compliance with all of the applicable laws and regulations. And I think it's high time. We've got a care crisis. We need to resolve it. And we did better when we had a more significant state presence.
Sure. Okay. Thank you.
I'm Eric Carlson with the National Senior Citizens Law Center. I've worked representing consumer interests in residential care facilities for over 20 years. And Our office, myself and some colleagues, recently examined the assisted living law of California and 11 other states in a report called Best Practices in Assisted Living, considering potential reforms for California. And the general takeaway from that report is that California is far behind the curve in dealing with the quality of care issues in residential care, significantly behind most of the other states that we looked at. As to the frequency of inspections, as to the states that we looked at that set a particular interval, virtually all of those set the interval between 12 and 15 months, which is also the interval under the federal nursing home reform law, which requires inspections, comprehensive inspections, on an average of annually, but as long as 15 months. And it's hard to overemphasize how important the inspection process is for residential care facilities. These are folks who are not in a position to call people up on the phone and determine exactly what their quality of care should be and monitor that. They're oftentimes very isolated, very weak. As Mr. Chicotel mentioned, these are folks that are much sicker with greater health needs than were the residents of these same facilities 10 or 20 years ago. That residential care facilities for the elderly now have a lot of residents who 10 and 20 years ago would have been in nursing facilities. They are people who are non-ambulatory. They are incontinent. They have colostomies. They have oxygen administration, some significant high care needs, and relying on inspections relying on complaints is unrealistic. And if you think about the time frame, we toss out 5 years, but if you think about 5 years, 5 years ago was a long time. 2009 was a long time ago, and 2019 is obviously far in the future. Mr. Chicotel mentioned this, or Senator Corbett, I believe, mentioned it. It's not just the enforcement of the law, it's the ongoing conversation between the licensing staff and the facility staff that's extremely important. The laws currently for residential care facilities, in many cases, are relatively vague. They say that the facility should do whatever's necessary, whatever needs to be done to deal particularly with some of these health care conditions, as I mentioned, the colostomies and oxygen administration. The standards themselves are not self-administering. The minimum standards, for example, for direct care staff are 10 hours of training. There's not a lot of solid, easily understandable standards there in a lot of cases and it's the better facilities have to have a understanding of what they need to do in order to care for these higher care needs. They need to talk with the licensing staff on a frequent basis to understand really what the quality of care is for these people, because they, in a lot of cases, just aren't going to know. And that's something that requires a continuing relationship to cite existing problems and also to educate the facility on what they need to do to deal with the level of acuity in their facility, which probably is going up and up and up each year. There's been some mention of the tragedies that the legislative analysis dealt with it, and the testimony that we've had certainly recognized some instances of really horrific circumstances that have popped up in the newspaper over the last year. Those have been ongoing over the last 5 to 10 years, and the tragedies happen. You get to a tragedy bit by bit by bit by bit when you have poor care and it's not dealt with and it's not dealt with, and people get sicker and it's still not dealt with. There's just not that kind of intervention, and then all of a sudden it explodes, and we all think, well, how in the world did that happen? Mm-hmm. And it happens because there's not the kind of ongoing, comprehensive visits that are necessary to maintain the level of care.
Okay. All right. Thank you very much. Are there others in support of the bill? Please come forward.
Gerald Richards for the California Senior Legislature. We support this bill very strongly.
Thank you.
Carol Sewell from the California Commission on Aging, and I'd just like to say that as someone whose mother spent the last 4 years of her life in an assisted living facility, the last facility of which was a 36-bed, I was one of 3 residents' family members who was there frequently. I was there all the time. There were not other family members there watching to report things. There were not other family members making sure their family members got to the doctor. It's essential that the state is involved because families are not.
Okay, thank you.
Richard Holliber, Consumer Federation of California, in support.
Thank you.
Brandon Tartaglia with Disability Rights California, in support.
Lisa Coleman with the California Long-Term Care Ombudsman Association, in support.
Thank you.
Isaac Taggart with the San Francisco Long-Term Care Ombudsman Program and member of the California Long-Term Care Ombudsman Association, in strong support. Thank you.
Krista Chalamides, Senior Advocacy Services Ombudsman in HICAP, in support.
Catherine Hundermark, Ombudsman Services of Northern California, in support.
Thank you.
Jim Gross on behalf of the County of San Diego, in support.
Thank you, Jim.
Aaron Court with the California chapter of the National Association of Social Workers, in support of this bill.
Thank you.
Heather Harrison with the California Assisted Living Association. Again, I want to thank the author and her staff and the sponsors for working with us on our concern. We've removed our opposition, and we'll continue working on the online posting section. Thank you.
Thank you.
Okay, thank you. Any others in support? Is there anyone opposed to this bill? Seeing none. Senator Corbett, would you like to close?
I think the witness, oh, do you have a question?
Just a real quick one, because
Sure.
this is a due pass, I get that. Now, we've only got one opposition that has remained out there, the Community Residential Care Association of California. Have you talked with them, and are they going to be able to get to yes, do you think?
Yes, we have been talking with them, and we're glad to continue talking with them to address any concerns they have.
Okay, how much money are we talking about here in the budget to fund this? Because it really should be done. But how much money are we talking about?
You know, I'm sorry I cannot tell you specifically, Senator Berryhill, but I do know, there's a lot of facilities, so it will cost a little bit. But it is something that I think is very, very necessary, and I'd be glad to have your support in making that point.
Yeah, well, I'm going to be supporting this bill, and I would be happy to move this bill when appropriate, Madam Chair.
Thank you very much.
Thank you, Senator Berryhill.
Thank you. Okay, so in closing?
I think the witnesses and the other testifiers said it all. I just ask for your aye vote.
Thank you. When the time allows.
Thank you very much.
Thank you very much.